Hello everyone, how are you? Welcome to the physioBRAIN channel. This is Professor Adriano, and today we're going to give you 3 exercise tips, and we'll talk a bit more about the rotator cuff. After all, which muscles are involved, and what can we do to improve and reduce pain in this area? Stay with me and don't miss out on this information. And don't forget, go ahead and like the video and subscribe to the channel. If you haven't subscribed yet, and share it with anyone you think needs to know this information. So, after all, what exactly is the rotator cuff? Which muscles are involved? It is basically made up of 4 muscles. The subscapularis muscle, the supraspinatus muscle, the infraspinatus muscle or infraspinosus, supraspinosus, and the teres minor. For those in the healthcare field, these muscles usually appear on exams. So these 4 muscles make up a region of our shoulder that is especially responsible for external and internal rotation movements. So normally after surgery, our shoulder is limited. It becomes a little more difficult to move, and it is normally because of them that we start treatment. Of course, it depends on each case, but these are muscles that are very important in recovery. So we need to know how we can work with them in a simple way. We're going to give you 3 simple exercises for us to work on. Since we're talking about rotation, especially internal and external rotation, we can work these muscles isometrically, that is, without generating movement. And we can also gain strength even without making movements. So if you are working post-operatively, if you have recently had surgery, consult your physical therapist so they can recommend the best exercise for you. But here, we're going to give you 3 tips on how you can work on this, how you can work with your patient if you are a physical therapist, okay? So the first one, we're going to be working on external rotation. So here, basically, the rotation we're going to work on isometrically will be trying to move outward, and with the other arm, I hold it in place. So you're going to apply force, and then relax. You can count to 5 during this movement, right? During the contraction. Count to 5 and lift. Apply force, count to 5 there and lift. All right. So we're going to be gaining strength and mobility in the shoulder rotators, especially the external rotator, with this exercise. And we're going to do the opposite for the internal rotator. So we're going to try to do the internal movement, internal rotation, and then we're going to try to, with the other hand, provide resistance. So here, apply force, and release. You can work at various angles here, so you can start from a more aligned movement, and you can work at different angles depending on what your goal is at the moment. So it's a very simple way to work, just giving you the basics here, giving you what is most essential, and you can adapt it in various ways. I work a lot with patients against the wall. You can work with resistance bands, with weights. It depends on your goal, it depends on what you want to work on. And the third and final tip for today, we're going to work on mobility for this joint. So we say that you glue your elbows here at your sides, open both hands here, and then try to hug your belly. So crossing from here, and crossing from here, and crossing from here. And what's interesting is that one time, let's say, the right hand goes on top, the next time it goes underneath, and you keep alternating like that and working on it. Releasers. Notice that one hand might go further than the other, so there's a slight difference in range between one limb and the other. That's normal, and we keep working on it. Accordingly, 3 simple exercise tips you can do to gain mobility and strength in your rotators, in your rotator cuff, okay? If you have any questions, write them in the comments, like the video. If you enjoyed it, share it with someone you think needs to know this, someone who needs this knowledge, okay? I hope you liked it and that I was able to contribute in some way. Take care, and I'll see you in the next video.